like to welcome you to this webinar that I will be doing on urgent care procedures in pediatric DPC. This is a repeat of a talk that I gave at the 2023 Pediatric DPC Mastermind in Florida. And it was well received, and I thought this content could be useful for a lot of other people. So I'm going ahead and recording it as a webinar for you. For many people in DPC, you might be coming from a background in general pediatrics, and you may not feel so confident with urgent care procedures like stitches and staples and a few other things like ingrowing toenails. So this is really an overview and a refresher to help you feel more comfortable doing those procedures and feeling comfortable knowing when you can take care of a procedure in your office versus when you need to refer out. And also just a little bit of a primer on what to stock in your clinic so that you can do procedures that you feel comfortable doing. All right, I have no disclosures or financial conflicts of interest. With our learning objectives, I'm especially going to focus on how to perform simple laceration repairs, foreign body removals, and treatment of severe epistaxis. Like I mentioned, we'll review which supplies to have on hand to perform these procedures. And then hopefully you'll commit to adding at least one minor procedure to the list of services available within your pediatric DPC or concierge practice. All right, we're going to go over lacerations and especially when to use sutures versus staples versus glue regarding lacerations on the face, scalp, mouth, and body. We'll briefly go over foreign bodies, epistaxis, ingrowing toenails, and then, like I said, what to stock and the estimated costs. Okay, let's dive into lacerations first. Our most common pediatric lacerations, based on what I saw working in pediatric urgent care for 3 years, plus moonlighting for a few years in addition to that, are forehead and eyebrow lacerations, chin lacerations, lip lacerations, scalp lacerations, and sometimes you see other body parts like ears, fingers, legs, etc. I'm going to go over some cases. So here's case number 1. This is a 2-year-old female that was playing at home and rammed her head into the edge of the counter, sustaining a laceration right above her right eyebrow, the central area of that eyebrow. Her parents applied pressure to stop the bleeding, and they send you this picture. So questions to consider in this case: does it need repair? And if you're going to repair it, what should you do? Can this do well with glue or Dermabond, or does it need something more stable like sutures? Here is a closer picture. It's hard to get it really focused, but there's as good of a close-up picture as I could get of this wound. And you can see that my fingers are pulling the wound apart a little bit. That's really important whenever you're evaluating a wound. You want to see how deep it is. And sometimes by just looking at a picture of it, you cannot tell how deep it is. It isn't until you go in there and you kind of try to widen it that you can see how far through it goes, how many layers are affected. All right, and we'll get back to what to do about those cases, but here's case number 2. This is a 3-year-old female who was running and fell on the sidewalk, hitting her lips against the concrete. The parents applied pressure to stop the bleeding and send you this picture. It's not the best focus, but you can see basically there's a gaping wound on the inside of the lip. And so questions to consider here: does it need repair? If so, what would you do to repair it? Here is another picture of that same wound, not the best focus, but you can see it from a slightly different angle. Okay, so let's go over some considerations for when to repair. First of all, is it deep or gaping? A picture may not tell the whole story, like I mentioned. Consider what it's doing with movement, especially with anything around the mouth. When they're just stationary and have a neutral facial expression, it might not look that wide or deep. But if they start to chew, if they start to smile or laugh, it might look quite different. So it's really important to, if the parents are sending you a picture, ask them, put your fingers around the wound and try to open a little bit and take a picture of it, send it to me. Or if you're going to assess them yourself, then go ahead and do that yourself.